Today we're going to be going over active stretches for the spine, the upper body, the lower body, wrist, feet, and neck. A couple of things to remember as we get started. If you feel any cramping or pain as you're doing any of the exercises, please stop and consult either with myself or with Shannon. We also want to do all of these exercises at about 10% of your total effort. So this isn't a work as hard as you possibly can. You should feel yourself calm throughout the whole exercise. And the purpose of active stretching is to create more stability at the end range of motion for any of the joints that we're working on. So, for instance, a passive stretch, if we wanted to work on the hamstrings, would be to try to force the hamstring with body weight and gravity into a more lengthened position. In an active stretch, what we're intending to do is to lengthen that muscle by activating the muscle on the opposite side of the joint. So, for instance, for the hamstrings, we'll be trying to strengthen the hip flexors and the muscles on the front side of the joint. So this is a great way to identify imbalances that you might have in your body and to treat them yourself and to prevent injury. It creates much better strength and stability at the end range of motion of the joint. So here we go. We'll get started with the torso. The first thing that we're going to work on is to stretch the back muscles. A lot of us have an issue with having very tight muscles around the spine. So what we're going to do is we're going to use the abdominal muscles and the muscles on the front side of the torso to lengthen the back. So we want to start with picking one leg up at a time. So we're going to bend the knee, bring it up toward the chest, and the other leg comes up. You're then going to take a hold of your lower leg, lifting your head and shoulders. You're going to create tension between your hands and your legs as you exhale and try to pull everything as close in and tight like a small ball as you can. Keeping pressure between your hands and your lower legs. And with your inhale, you come back down, sending one leg down at a time. Resting your shoulders. You rest there just long enough to reset. A full inhale. And then you bring one leg up. The other leg up. Taking the whole of the lower legs. And with a contraction of the abdominal muscles, you press the spine back into the floor. And with your inhale, you come down. Setting one leg down at a time. And we'll do this one more time. Depending on the length of time that you have, you could do as many repetitions as you want. There's a minimum of 3 repetitions through each exercise. So we're going to go through them in 3s for this activity. So one leg up at a time. Exhaling, taking a hold of your shins. Pressing your legs into your palms into your legs. And with your inhale, you set back down again. So that's the end of the active stretch for the back muscles. Now what we're going to go into is with the legs out straight. We're going to go into a back extension. So what we want is a nice big arch of the back. You're going to reach your arms overhead. Out through your fingertips and out through your toes. Lifting your back up off the floor as much as you possibly can. Exhaling and tightening your abdominal muscles because you still want the stability there for your low back. As you inhale, you just release everything and rest yourself back on the floor, bringing your arms to your sides. We'll go through this one again 2 times. So reach the head, arms overhead. Inhale, reach, and then exhale and tighten the abdominal muscles. Protecting the low back, out the toes, out the fingertips. And rest with your inhale. One last time. And come back to your neutral position. Okay, so we have 3 different directions that the spine can move into. We have 4 really. Back extension, which we just did, spinal flexion. We have side bending, and we have rotation. We're not going to work on the rotation piece on the floor. We'll get to that a little later. So we're going to go into a side bend. Shannon's going to first side bend to her right side, so she's going to reach her left arm overhead. She's going to start to reach for her toes with her right fingers. She's going to bring her right leg out to the side. And she's going to create one big, nice, long reach, like a half moon. And the same thing, holding through an exhale, coming back to your neutral start position. And now with this one, each one of the 3, we're going to change the position of the leg. That time she had her toes just pointed straight up in a neutral hip position. This time she's going to turn her leg out. She's going to reach the left arm overhead again. She's going to keep that turned out position of her leg as she reaches, again with her right fingertips down toward her right foot. Nice big arch and side bend for the full exhale, and then back into your start position. So we did the leg in a neutral position, turned out. The last one, you're going to bring the leg into a turned in position. So you lead with your heel, taking the leg out to the side, reaching that same arm overhead. And again, creating that C shape or a half moon to the right side. The back is arching. Again, with each exhale, you're tightening the abdominal muscles and returning to your start position. Moving away a little bit so that she can come to the other side. So she's going to reach her right arm overhead. She's going to keep the leg in a neutral position, so the toes are going to point straight up to the ceiling. She's going to try to touch her fingertips, her left fingertips to her left toes. And exhale. Nice tight contraction of the abdominal muscles and back into the center. This time we're putting the leg into a turned out position, leading with the toes toward the wall. And a full exhale. And returning back to the center. So ideally, once you're in the position, you're there for 5 seconds. So that exhale should count for about 5 seconds. If you wanted to actually count it, show you with the heel, go into her side bend. This is an inhale. When she gets into the position, she's going to exhale 2, 3, 4,